Eye care, your vision is our priority. I'd now like to talk to you about oculoplastic surgery. Oculoplastic surgery is plastic surgery around the eye, generally to the eyelids, both upper and lower. I would now like to discuss the different conditions that generally affect the eyelids and require oculoplastic surgery. The first condition is ectropion. Ectropion generally affects the lower eyelid and is the condition where the lower eyelid turns outwards. This gives the lower eyelid a very red appearance because the inside of the lower eyelid is facing outside, and that is a mucous membrane. A mucous membrane is like the inside of your mouth. It needs to be kept very moist and is a very sensitive tissue. As a result of this mucous membrane, or conjunctiva, facing the outside, it dries out and becomes inflamed, and this is the reason it appears very red. Some of the symptoms of an ectropion, or outturning of the lower lid, are irritation of the eye because the eyelid is no longer protecting the eye, as well as watering of the eye and tears running down the face. This is because the lower eyelid acts like the gutter on a roof. When it rains, water runs off the roof into the gutter and is conveyed along the gutter down the drain pipe and into the drain below. This is a similar circumstance in the eye. The lower eyelid needs to be opposed to the eye very closely so that the tears are drained across the eye towards the nose and go down a hole similar to a drain pipe into a drain. We call this the nasolacrimal duct. In the situation of an ectropion, there is a similar circumstance to if the gutters are half hanging off the roof. The water runs down the roof and does not make it into the gutter and overflows onto the veranda below. An ectropion is caused by a withering of the tissues of the lower eyelid and also a disconnection of the muscle of the lower eyelid. It is repaired by refashioning a tendon close to the ear and re-sewing the eyelid onto the bone of the eye socket. The muscle of the lower eyelid is also tightened through the inside of the eyelid, and this causes the eyelid to become closely opposed to the eyeball and also to act as the gutter that it should be. This procedure can be done within the clinic under local anaesthetic and sometimes a tablet sedation. Sometimes there is a little bit of discomfort where the eyelid is re-sewn onto the bone of the eye socket. However, recovery is usually quite swift because the eyelid has a very good blood supply. Sometimes lower lid ectropion is complicated by scar tissue. This is particularly the case in people who have had a lot of damage by the sun. In this circumstance, there is very few wrinkles in the lower eyelid, and that means there is not enough skin on the front of the lower eyelid. Under these circumstances, a skin graft, usually taken from excess skin in the upper eyelid, is placed. This is called a cicatricial, which is another word for scar tissue, a cicatricial ectropion. This is a more complicated procedure than a usual ectropion, which is known as an involutional, which is another word for withering ectropion. As with all operations, hemorrhages can occur, infections can occur, stitches can break, but generally speaking, it is a very safe and effective procedure. Sometimes very observant patients might notice that the lower eyelid is slightly shorter. This is because it has to be shortened to fashion a new tendon. Very rarely is this cosmetically apparent. The next condition I would like to talk about is entropion, or inturning of the lower lid. Funnily enough, this is caused by exactly the same factors that cause an ectropion. However, in some circumstances, instead of rolling out, the eyelid rolls in. This is obviously very uncomfortable for the patient because the eyelashes rub upon the eye. This can cause ulcers on the cornea of the eye, and therefore the condition needs to be remedied. In the short term, a contact lens can be placed on the eye to protect the cornea. However, the operation is virtually the same as that for a lower lid ectropion, with the exception that a couple of sutures are placed to turn the eyelid outwards as well in the operation. I would now like to talk about various lumps and bumps that occur on the eyelids. Sometimes these are benign, sometimes these are sun cancers called basal cell carcinomas or BCCs, and sometimes they are SCCs or squamous cell carcinomas. It's very rare to see a melanoma on the eyelid. Depending upon the size and location of these growths will depend upon the technique used to remove them. If they lie upon the margin of the eyelid, the whole eyelid needs to be cut out with a margin of safety and the eyelid joined back together. This is called a wedge excision, and sometimes, because it's a very tight repair, a little nick is made over near the ear to release the tendon there so there's not so much tension on the stitches joining the eyelid back together. Otherwise they cheese wire through and the wound breaks down. If a full thickness excision of the eyelid is not required, the bump can be removed just by removing around the skin, then the defect is repaired with a flap. A flap is some skin which is moved across from an adjacent part of the eyelid to fill the void. Sometimes when removing tumours from the eyelid, it can be found that the whole of the tumour has not been removed. This is because it's very difficult to exactly predict where the margins of the tumour are. Obviously, we want to take the whole tumour out, but we don't want to take too much tissue because we have to repair the defect with the flap. Sometimes a tumour can be considered like an iceberg, with only a little bit pointing up above the water and a lot below the water. This is an acquired skill, and sometimes no matter who's doing the operation, the whole of the tumour is not removed. The options in this circumstance is to either go back and take more tumour or have some follow-up radiotherapy. It does depend upon the pathology result as to whether the tumour is benign or malignant. Sometimes these concepts can be very difficult to understand, and we're here to explain everything to you and to give you as much education as you require to make an informed decision about your management of your eye care. So to conclude, I'd like to thank you for